The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with another edition of what's now inside JACC. And I'm talking to Dr. Paul Heidenreich, who's the primary author of a very interesting paper in JACC that deals with the important topic of rehospitalization and actually subsequent mortality in patients treated with heart failure in the VA system. So, Paul, can you just briefly give us an overview of the analysis that you did?
Yes, we looked at patients hospitalized for heart failure within the VA system in 2002 and compared those to the hospitalized in 2006. And we wanted to see if the readmission rates and the mortality rates, along with other patient characteristics, changed during that time. Our main findings were that mortality decreased, perhaps as expected, given a reduction in or an improvement in medication use. However, readmissions increased, which was surprising to us, and I think an interesting finding.
Yeah, now, we were surprised that you were surprised. It seemed to us somewhat intuitive that if patients were not dying as quickly and as frequently, that in fact they would survive to be rehospitalized again. So what was it that you found particularly surprising about this?
Yes, well, that's a very good point. The reason we were surprised is that the medication use, such as beta blockers, ACE inhibitors, in general, the recommended care had improved, and all those medications both improved mortality and decreased the risk of hospitalization. So we are hoping that as overall care improved, both rehospitalizations and mortality would improve. But I think you're right. I think that probably is a contributor, that the fact that patients are surviving longer just makes them more likely to be at risk for hospitalization.
I think one of the important aspects of your study was the change in comorbidities. Can you tell us a little bit about that?
Yes, it was somewhat interesting that we found that coded comorbidities increased over that period. There was more coded renal dysfunction, more prior heart failure, and that could be expected if patients were being kept out of the hospital and only the sickest ones were being admitted. But also we noticed when we looked at actual laboratory values, the creatinine, the BUN, those laboratory markers of renal function didn't get worse. In fact, they actually slightly improved. So there was a slight disconnect between the coded and the laboratory values. Now, I will say we looked at the predictive value of those coded diagnoses. They remained similarly predictive over time, so it wasn't just that people were overcoding in 2006, but it is a complex situation. I think you need both diagnoses and laboratory values to get a clearer picture of what's actually going on.
Well, we had published a paper earlier in JACC that had the very interesting finding that the majority of rehospitalizations in patients with congestive heart failure were actually due to comorbidities. And your paper showing an increase in comorbidities is consistent with that. And so if you take these two things together, one, that the mortality in heart failure is falling, and two, that the comorbidities are increasing and in fact often the cause of rehospitalization, I guess it calls into question how valuable rehospitalization is as a quality indicator for the treatment of heart failure.
I think you're exactly right. And in part, the VA has responded to that in looking at not just rehospitalizations, but overall hospitalizations for heart failure. I think we're probably going to go in that direction where we define a baseline of a cohort of patients with heart failure or at risk for heart failure and look at their admission rate rather than the readmission rate, which could, as you mentioned, be a sign of good care.
Yeah. Well, thanks very much. These are very important data. It's important for analyses like this to point us in the right direction so that we can really analyze quality in an effective manner. For Inside JACC, I'm Tony DeMaria.
The Genuine Article. Discussion and commentary based on articles from JACC.